Mrs. Smith. I'm your nurse for this shift. My name's Lily.
Hi.
So your provider wants you to take a new medication for your blood pressure. It's called Propranolol.
Okay, what's that for?
So it's for your blood pressure. The normal blood pressure we like our patients to have is about 120/80. The past few days of you being in the hospital, your blood pressure has actually been kind of high. Your last few have been 162/99, 165/102, and 170/104.
Oh, wow, those are high.
Yeah, so the blood pressures have shown that you are in the moderate level of hypertension, which just means that you have consistent high blood pressure. This stage is known as stage 3. The different stages are pre-hypertension, which would be stage 1. That's 120/80 to 139/89. Mild is stage 2, 140/90 to 159/99. And then stage 3, which you're in, and stage 4, which is severe, which is 180/110 or higher than that.
Okay.
We're just concerned because as your care team, if we continue to let you go on with these high blood pressures without treatment, you could have complications from this, like even a heart attack or a stroke down the line. It kind of gives us a clue on how hard your heart is pumping with the resistance of the vessels around your heart.
Okay.
Giving back to the heart, which is trying to pump blood through your body, as you probably know. So I'm just going to give you a couple reasons why your blood pressure might be running high. Your genes that you inherit from your parents, I don't know if you know that your parents may have hypertension as well, but it can be inherited.
Okay.
Physical changes of the body, like your kidneys not balancing your salt and water well, can affect you. And then also not making the best choices with the foods that you eat or the amount that you exercise.
Okay.
So diet change and exercise can actually help you too, along with this medication.
Okay. So I should do that on top of taking it?
Yeah.
Okay.
So if you think about your heart like a stress ball, like this one, the more that you're stressed, the more you're going to squeeze the ball. That's kind of like your heart. The more stress on your heart, the harder it's going to try to squeeze, and the faster it's going to try to squeeze.
Okay.
So the propranolol basically works by making your heart beat slower with less force. That's with any beta blocker, which is the category that it's under. And so that will help lower how much blood is going to be pumped through your arteries and the speed of that.
Okay.
It will also block the beta adrenergic receptors, which are just the receptors that kind of signal your heart to do things like beat hard and fast. And that's pretty much it. It doesn't seem like you've been symptomatic from the hypertension, which is normal, but if you do experience symptoms, it could include things like headaches, shortness of breath, nosebleeds, flushing of the skin, dizzy, chest pain, visual changes, or even blood in your urine. I don't know if you've been experiencing any of those.
No, I haven't really had any symptoms.
So, do you have any questions about the medication?
Not so far.
Okay.
Hi, Mrs. Smith.
Hi.
I understand that you're starting a new beta blocker.
I am.
Known as Propranolol for your blood pressure. We're just going to go over some of the different types of side effects that can occur when taking this medication.
Okay.
So, there's none that are super serious that you should be concerned about, but some patients may notice that they have a little bit of dizziness, or they may have like hypotension, which is low blood pressure. They may also have a low heart rate just because the medication works to already lower your heart rate. It might become a little bit too low. Something that you might notice is you might feel like a little bit lightheaded. That would come from the low blood pressure. So if you do feel like you're getting lightheaded when you stand or just in general at all, it would be best to call the provider and just to let him know, just so that they're aware. They might have to lower the dose or something.
Okay.
Some other side effects, you might feel very like weak or fatigued at first. It could give you a little bit of anxiety. the fatigue and the weakness could be like a new change or something that might persist just depending on how much it brings your blood pressure down. So it's something that we like to monitor at first, especially because you're a stage 3 for your category of high blood pressure. For any interactions when taking this medication, you shouldn't take any other hypertense this medication just because it can affect your blood pressure, and it'll also affect the effects of the propranolol. Also, this medication, when you are taking it orally, it gets absorbed through your digestive system. So it's best to make sure that when you're taking it appropriately with like food and water, just so that everything gets absorbed the way that it should. Those are some of like the more common side effects. Do you have any questions regarding any of them?
I don't think so.
So what types of side effects are you aware of now that you have had this encounter where I taught you the things that you should be looking out for?
So you said if I get lightheaded to call the provider.
Mm-hmm.
I haven't really had that. I guess I had felt maybe like a little more tired or weak lately, like you said.
Yeah, and that's
but
probably
nothing
just
crazy.
from the lower blood pressure, just because your heart isn't beating as fast and your blood vessels are more relaxed, which is something that just occurs with propranolol.
Okay. Yeah, other than that, I think the medicine really hasn't affected me.
Okay. Some patients might feel a little bit nauseous and might have some GI symptoms, which is like all of your like gastrointestinal, stomach, and like digestive system issues. These are a little bit less serious. They don't occur as much. And you can always just tell us again, call the doctor if you are suspecting any of that as well.
Okay. Perfect.
Okay. Sounds good. So for this project, I used the teach back method to educate the patient.
And I used a tactile visual source with the stress ball.